Tioga Dental is a unique practice in that you have a group of dental professionals who have come together collaboratively to focus on patient care. People who can really work with the patient to make them better, to make them healthier, to make them happy and proud when they smile, and be able to put themselves out there. You know, one thing I hear all the time from patients is that they get frustrated with getting referred out all the time. That's one reason that we've brought a team of specialists here. We enjoy the collaborative effort, and by not having to go all over town and go to different specialists, we tend to cut through that in a very efficient manner, and the patients really seem to like it. We treat children, we treat the whole family, from implants to pediatric care, veneers, crowns and bridges, but we feel that with the technologies that we've been able to bring in, we can really make decisions in a better, more educated manner, and the overall result is going to be better.
So we're really excited about a few new technologies we're using here at Tioga, one of which is the Oral ID. This is a small blue light that uses fluorescence to highlight any early abnormalities in the tissues. And it's a great tool for screening for oral cancer or early oral cancer lesions. Early detection is important because in the oral cavity, a lot of times when we can see the lesion, it's oftentimes too far along. So we really recommend it for all of our patients 18 and older. Another technology we have is the iTero scanner. It's a wonderful impressionless system that takes 1,000 scans of your mouth, and it does it in under 5 minutes. It allows us to build a 3D model from those scans. And when the lab receives it, we can make crowns, we can make retainers, mouth guards. We can design and do implant-guided surgeries, and we can also track whether tooth wear has gotten worse over time. And that's a great tool, and patients love that.
I'm a pediatric dentist here at Tioga. I see kids between the ages of 1 to 18. We offer comprehensive dental care for these ages. A child should be seen within 6 months of their first tooth erupted. This is the age group that you can have the greatest effect as far as establishing dental habits early on. So ideally, here at Tioga Dental, when your child comes for the first visit, the emphasis is definitely towards the preventive aspects of brushing, avoiding cavities, getting their fluoride in their toothpaste. Here at Tioga Dental, my main concern is getting the patient comfortable in a dental setting. I do not force them to sit in the dental chair if they're not ready. If I have to brush their teeth standing up, we do. So basically, it's tailoring to your child's comfort. At the end of the visit, we try to positively reinforce by allowing them to pick their fun stuff at the treasure chest. We aim to give you guys a fun experience here at Tioga. It's very nice to see kids grow with our practice and transition out, so it is a very satisfying professional experience.
Well, I was having a lot of discomfort in the gum areas. It was starting to get extremely painful. The dentists were advising that I should have procedures that I didn't really want to go through. So I did some research and found the LANAP, that's this laser surgery, is being done by Dr. Craighead at Tioga Dental. When the machine was actually being used on me, there was no pain, no swelling. All in all, a very good experience.
Many of our patients come in because they have bleeding gums, they have discomfort when they're brushing, when they're flossing. But the problem is that they actually have a bacterial infection in the gums that they may not be aware of. In the past, this required a very invasive surgery. Now we have the only FDA-cleared laser for true periodontal regeneration, and it's called the LANAP system. Literally by moving this laser beam around the gum tissue, we're able to eliminate the bacteria and some of the diseased tissue without making a single incision. I mean, patients are going back to work the next day. They're having very little discomfort. They usually don't need to take any pain medication afterwards. It's really an amazing system, and it's been working out fantastic. We get a lot of patients that come into our office with missing and broken teeth. Many of these patients had been told for years that they weren't candidates for dental implants because they didn't have enough bone. I can grow bone with advanced techniques so that almost every patient out there is a candidate for dental implants. And it's amazing how we're able to change their lives. We're able to completely restore that patient's smile, restore their function so they can eat anything they want. Patients have huge grins on their face when we take those after photos.
Before I got my dental implants, I had trouble with my chewing. I can remember the first time it really hit me how much of a difference they made. My wife and me were eating in a restaurant, and when we got through, she said, "You know what just happened? This is the first time that you've ever finished eating before I did." And right then I realized that these dental implants was one of the best decisions I could have ever made.
For the best and comprehensive dental care for your whole family, visit the team at Tioga Dental.